And hello, everybody. Hi, this is Kathy Prey from IMCO, from the International Integrative Maternity Healthcare Organisation. And welcome, everybody, to this week's webinar. And for part of our maternity natural health series. And I'm very pleased this week to have Angela Smith here. Angela, say hello.
Hi everyone, how are you going? From Perth, Australia, so very early in the morning here. So
Yeah, it sure is. It's it's very early there. We were just talking about COVID and how with Perth being quite geographically isolated, it's certainly been a kind of advantageous for you guys a little bit.
yeah, it has
I
its
guess.
positives and
Yeah,
negatives,
just
so depends
to
which
keep those
one.
borders pretty tight. Yeah. So look, welcome along everybody who's just coming in. And just a reminder that if you're new to these webinars, we'd love to know whereabouts you are in the world and your role. If you're a health professional, birth practitioner, naturopath, or whatever your role is, just click into that chat area and let us know where you are and your role, or maybe you are a expectant mum. So that's all wonderful as well. And then also down the bottom, just a reminder, there's a little button there with the Q&As. And feel free that if you've got any questions for Angela, to just type them in there, and we'll absolutely make sure that we get through the questions before the end of the webinar. There will also, for those of you who are watching live today, tomorrow you'll receive an email as well that gives you a copy of the webinar. So that is just awesome. So welcome everybody along, and we've got we've got Francis here from Tennessee, USA. Oh, howdy! That is just wonderful, and yeah, great to catch up with everybody. Well done. So let me introduce Angela to you, and we'll get going on this webinar today. And Angela is a mother of 3. She's a registered nurse and a midwife for the past 20 years. And during the last 5 years, she's been particularly interested around the subjects of nutritional and integrative healing, intuitive medicine, birth trauma counselling, and most recently the CalmBirth Education. Angela also has extensive experience in high risk obstetrics, which is, I always think, a really interesting sort of balance, to especially when you're dealing with those high risk women, and how it's still possible to keep things normal, or as normal as possible. And I'm sure you'll talk about that. And she's worked across the spectrum of all areas of maternity care, including both private and public sectors. And as Angela herself says, being a midwife is just part of the essence of who I am as a person, more so than a job. I think that's just so true. It's sort of part of our DNA of our who we are and what we stand for. And she's always felt extremely privileged and honoured to be a witness and part of that raw emotion that birth sure is. So these days, Angela is enjoying incorporating what she's learned in life journey so far to help others with the pregnancy journey. So welcome along. And yeah, do you want to, before we sort of go into the topics, do you want to add in any sort of a little bit more overview about who you are?
Well, I mean, you touched very briefly, I guess, on the last 20 years, but just to give a bit more of an in-depth wind down on that, I guess, I've always wanted to be a midwife. I was lucky. I was one of those people that knew that I wanted to work with babies and look after people right from the time I was almost a toddler myself. So really lucky that I had that, because I know a lot of people don't, a lot of the kids out there these days don't have any idea by the time they get to the end of school. So I actually worked my way up a little bit through the ranks. I did enrolled nursing first, and then registered nursing, and then finally went into midwifery in 1999, and started out working actually in a country hospital in New South Wales, which was really nice because you get your nice normal deliveries. Oftentimes you're the only, one or two midwives in the hospital, and so there's quite a lot of autonomy. You've got a good rapport with the GPs and things like that. And then in 2006 I moved to Perth and was initially doing a little bit of agency, so working in all the different hospitals just to get an idea of where I wanted to be, and somehow got flung into the throes of birth suite in the women's hospital here in Perth. And as scary as it was at the time, I absolutely loved it. And, just, I guess, having had nursing experience in emergency nursing and not knowing what was going to come in the door, it actually blended quite well with high-risk midwifery, because you're dealing with those sick women and sick babies, and you never know what's going to walk in the door. And so I loved combining that. And then so I did that for quite a long period of time, all the way almost until the end of 2014. And then we had the opportunity to move overseas to France for my husband's work. And it was a bit of a self journey for myself. I wasn't allowed to work as a midwife at the time. So I guess I almost had to reinvent myself in some ways, absorbing the experience of living in another country and dealing with the difficulties that go with that. And I had a period where I was quite unwell, and I did quite a lot of research into nutritional medicine, and I'd always been very aligned with alternative methods of healing and nutrition for healing the body as a first port of call, I guess. And so when I came back from France, I did some nutritional medicine, and I thought, I'd really like to see how I can combine this with what I know as a midwife and a nurse, and use it to help, a lot of couples out there. And, at different times it was like trying to convert the unconverted, especially working in a hospital scenario. It was quite difficult, which led me to, I guess, meditation and visualization, and combining all the things you learn, I guess, in your life journey with all the things you know, as a birth professional, and then, drawing from all your integrative places as well, and thinking, well, how can I expand on this? And, CalmBirth sort of happened to come across my story in a personal way, and it aligned a lot with what I was interested in from a personal point of view. And so that's, from a midwifery point of view, that's what I concentrate on mostly now, is bringing in all the points of what I've seen, being a birth professional in high risk obstetrics, and also seeing birth trauma counselling sort of in the postnatal sector as well, and trying to draw on all the pieces and then bring that into an education for women where they can actually feel, because I think now a lot of women, I guess, hand their power over, I suppose, when they go in to have a baby, and they sort of lose confidence in themselves. So I find a lot of what I do now is instilling that confidence, showing them that they've actually got what they need inside. They just need a little bit of guidance sometimes.
Well, that kind of leads us into that whole CalmBirth topic. So for those watching or listening, because this gets turned into a podcast as well, can you just explain what CalmBirth is, and yeah, so just introduce that concept to us?
Yeah, so look, CalmBirth is a program that was devised, and I guess there's probably quite a few names out there in CalmBirth throughout the world. But in Australia, CalmBirth is an antenatal program. Okay, so it's actually an accredited evidence-based program in Australia that was founded by a man called Peter Jackson. Hey, Pete, if you're tuning in. So Peter is actually an Australian nurse and midwife who founded the program, and he's got over 40 years of experience in the field, as well as being a mind-body practitioner. So he drew on all his experience across that board to, you know, devise the CalmBirth program. And, you know, the whole program, I guess, draws on being evidence-based. It's got that research. So you're looking at your areas of neuroscience, psychology, as well as midwifery. You're drawing on the areas of epigenetics, which is actually starting to be quite huge now, because
Yes,
you can see in not just birth professionals, but amongst the medical profession, you know, they are starting to bring epigenetics into a lot of what they talk about nowadays.
So when women or couples decide that they're going to participate in a CalmBirth education, what does that sort of end up formatting like for them? So is this, you know, something that they achieve on one Saturday, or, you know, kind of how does that, what's the practical side of how couples are learning about CalmBirth?
The CalmBirth format is really the practitioner can devise it to work in with themselves, which is great, and we can also work around couples. So for myself, speaking for myself, because we're quite isolated in WA, we have a lot of people that do fly in, fly out work in the north of WA, and so I get calls from people saying, look, I've seen the CalmBirth program online. I can't come to the dates that you've got listed, you know, but I'd really like to come. And so usually, you know, I try and work out dates that can work between the couple and myself. And that would either be, so the course is a 12-hour course.
Right, okay. So then it can be done over whatever sort of...
Yeah, so really the most common one is really 2 full days.
Yes.
or 3-hour classes. And
then, can you give us a bit of an introduction from the nutritional healing aspect that I know is one of your specialties, and sort of how that links in with CalmBirth?
Yeah, so it seems a bit of a strange combination.
It's funny because it does sort of have that strange combination, and that I don't, you know, it's not a combo that you hear of many people doing, but man, is it like a sensible combination? Yeah, I think it's really obvious. So it's really neat to see that you're doing that. So tell us more about that.
Yeah, so I obviously, as I was saying to you before, bring nutritional medicine in more from my own personal interest, and you know, as we see more and more people, I guess, with autoimmune issues, illnesses that can't be explained by, you know, people are sick for ages, and you know, they're seeing their doctors and they're not really getting any answers, and so I like to bring it in with what I know, because, and it's a massive topic, and it really deserves a webinar of its own. But I like to, I guess, link it with CalmBirth as a holistic link, because our nutrient status and our diet has a massive impact on the body and the mind. And so when we're talking about CalmBirth, the basis or the beginning of the program that we talk about with CalmBirth has a lot to do with the body and the mind as well. And so everything's interlinked, as you know, when you work in birth and you work in health and you start drawing on all your integrated methods, you know, you're not just a uterus or a spleen or whatever it is, you're a whole person. And so by looking at the two, you're looking at the person holistically, not just as a pregnancy or a uterus, if that makes sense.
Do you, Angela, do you kind of come across recurrent themes within that? Like, do you sort of, I mean, I'm probably oversimplifying it, but, you know, is it sort of the thing that you might say, oh my gosh, you know, 70% of the women that I see are always too low in their iron? Or, you know, is there like, are there patterns that you see that are quite recurrent, that sort of women could like almost or take charge of themselves, you know, when they don't have access to somebody like yourself?
Yeah, look, the biggest pattern, I guess, that we see nowadays is that, I suppose, how can I put it? Often with nutritional healing, you get a lot of women that are borderline, their nutrient status is actually borderline or low. So that's their nutrients across the board. So, I mean, you do see a lot of women that come in that are pregnant that have low iron, which is probably, for birth professionals out there, it's, you know, it's one of the most common ones. But the things that are not common, that you're starting to see more commonly now, is your low vitamin D, you know, even your blood plasma levels of zinc and C and all your micronutrients that you need for skin integrity, you know, your thought processes, your microbiome, your gut. So, you know, how healthy your gut is, whether you've got a dysbiosis, that's going to ultimately affect the mind-body connection, which can link to then anxiety. You're looking at postnatal depletion. So if a woman has a low borderline, you know, nutritional status, as you all know, being birth professionals, it can, you know, it affects the fetus while the baby's in utero, but it has a physiological effect on the mother while she's pregnant, which can then have immediate and long-term effects, you know, for the mum once she delivers, and then also for the breastfed baby. So you tend to, you start at one point, but you actually you see effects of it throughout.
Yes, absolutely. So so what's the sort of main area that you end up sort of treating on? Or I mean, can it be as simple as women just sort of taking a really good quality multivitamin, and then you know that they've sort of at least covered off, you know, all that sort of aspect of it, and you know, I'm sort of wondering, or like, I guess what I'm heading for is if we can, are there some like practical tips that you might want to share with the viewers on some things for them to look out for their woman?
Yeah, look, it depends a lot on the woman. It depends on the model of care that she's going through. So for most women, their nutrient status is going to depend on their diet. And as we all know, the food that's grown is often in suboptimal soils now.
Absolutely,
so,
yeah.
You know, the diet that a woman's having is going to have a big impact on that nutrient status. But if she doesn't have access to clean food or organic food, and not everyone does, that can have a big impact. You know, I guess, you know, for most women that feel reasonably healthy in the pregnancy, they could just take a multivitamin. But for a lot of people that feel a bit untoward or are really fatigued and stuff like that, depending on who they go to, like if you're seeing a lady who doesn't really have a lot of knowledge on, I guess, diet. And when we say diet, most people out there know that to feel healthy, whether you're pregnant or not, you need to improve your diet. but not a lot of people know exactly what they should be doing or what they need to do to
Yes,
get to that
very
spot.
much.
You know what I mean?
Yeah.
So I always encourage, like especially for birth professionals, is to reach out in your allied health professional team, I guess. So if you're a GP, you know, reaching out to nutritionists or someone who's got nutritional medicine within that, I guess, birth professional field, and getting to know the people that are around you. So you can say, look, I've got this lady who's presented, she's 32 weeks, bloods are borderline, you know, but she really needs a little bit of extra help with her nutrient status. Can I refer her across to you? And I know there's lots of people vice versa, so nutritionists, naturopaths out there who'd love to have that collaboration with integrative doctors and GPs and stuff like that.
Oh, yeah,
So that's
absolutely right. Yeah. And
the
I mean,
birth.
that's that joy of that integrative, isn't it? Of,
That's
having
right.
our medical professionals, confidently and want to collaborate, healing and treatment with their holistic professionals. Um,
Yeah.
yeah.
So,
Well, let's get back to the topic of CalmBirth, which I know is a real focus for you.
yeah.
So uh, I've got that question of, does the name CalmBirth imply that it's only for people wanting a calm natural birth? Because I guess there's a real strong association on that one.
Yeah, well, yeah, I mean, I could answer that question both ways, I suppose, yes and no, because I suppose it's quite funny because the name calm birth implies a certain scenario, doesn't it? Like calm birth implies this nice, natural calm birth. And
It implies a result.
that's right. And so I work in a medical practice with lots of general practitioners. And, I know some of them say, oh, well, what does calm birth mean? Does that mean you've got candles and everything around and stuff like that? So I guess, getting it across to the wider community of birth professionals and for any mums and couples out there, basically calm birth is for anyone. It's for those who want a nice natural birth, but it's for anyone, even those who are booked for a cesarean. You may have someone who's a multi who's come to you, who's pregnant with her third baby. She's had 2 previous VBACs. Sorry, not 2 previous VBACs. She's had 2 previous cesareans, and she's really hopeful for a VBAC this time.
Mm-hmm.
So you might get someone like that who says, look, I'm really hopeful for a normal delivery this time, and I need a bit of guidance with that. So you get a broad spectrum, I guess, and the idea is that the program is there to give people the tools and the knowledge that they need to navigate the birth journey in whichever way it unfolds. So even if they go into labour normally, they're a normal low risk pregnancy, and for whatever reason that journey doesn't go to plan. And as all of us know, being birth professionals, obstetrics doesn't always go to plan. It can be unpredictable, but the idea
Yes, there's that say that the one thing with birth that is predictable is that it's not predictable. Yes.
yeah, that's right. And it's a bit like, we talk about a labyrinth or, a roller coaster. Birth is the same kind of thing, you're navigating these turns and I guess hills and things in the journey. And while it may not always go the way that couples preempt that it will go, the idea is that they will gain the tools and the knowledge that they need, that if things do, I guess,
Yes.
go untoward, they can still make it a positive experience for themselves.
So that's a very specific part, I guess, of CalmBirth, is that it is giving those tools for when things do become obstetrically complex. And I think that I'm sure other birth practitioners are the same, that they would have heard complaints over the years of women or couples who have attended childbirth education, and this is not a slur on childbirth educators at all, because I know that they tend to be sort of needing to follow a particular curriculum, but where couples have things have gone sort of to custard a little bit along the way, and they realized that all of those complexities were not discussed, and
Right.
they felt that they were a little bit glided over, and that they didn't have the resources when that occurred for them. And so tell us, I find it's great to you talk.
Sorry, no, you chatting there made me think of something too that I'd like to point out, because I tend to hear this a little bit within the community these days, is that calm birth doesn't necessarily, I guess, imply quiet birth. So I've seen, obviously out there, you see it amongst women talking that are pregnant. You sometimes hear it from other practitioners. And, I suppose the point that I want to make there is that you can still, I guess, there's plenty of women out there that roar their babies into life. You can still be birthing, you can be primal and guttural and I guess vocal, which is a really normal, natural part of labouring. But I guess the essence of that is that you can still be calm and centered within. So you
Yes.
can still feel empowered within and be able to go through that process while being, I guess, roaring your baby into life. And that's the point that I like to make, because people, often link the two and think, oh, does that mean that I need to be quiet? And no, it doesn't necessarily.
No, and that's a really good point. And because it's almost like sometimes women need that permission that it's okay, to be loud.
Well, for want of a better term.
It reminds me of my second birth. This is before I was a midwife, and I was really loud with that one. And I do remember later as a midwife being in the same hospital in the same birthing room, thinking, man, I can't remember many women who were as loud as I was. So I was always thinking, I wonder what the midwives were thinking, in their office kind of area, going, boy, have you heard the woman in room 4?
I'm sure we've all come across it, and I think it's just,
But it was great, because in a way I wasn't a midwife, and then I didn't have those concerns really. But I think a lot of women do, and they feel like there's this pressure on not just achieving a natural birth, but achieving a natural birth a certain way, which is nuts. Yeah.
And, tends to preempt, when they put so much pressure on themselves, you tend to see the result of that postnatally.
Yes,
not for everyone, but, if it doesn't go to plan, you do see, the smallest little thing can trigger some people, when things don't always go to plan. So
absolutely. Hey, you've got a couple of really interesting documents that we could share with the viewers, which I'll put them up on the screen so you can explain them. And tomorrow, those that are watching live and those that are watching later will receive an email where you'll give you instructions on how to get copies of these. So let me just share my screen so we can do that. Okay. And so, excuse my crazy looking desktop. Okay, so this one here, do you want to just explain this? So this is a 2-page document or 2-page brochure.
Yeah, so I've actually got the pamphlet here.
Right.
So that's the CalmBirth pamphlet. So I've got the hard copy here, and you've got an online version. So this pamphlet is basically what couples may either receive from their maternity caregiver, or they may, you know, find it amongst advertising or from friends and things like that. And the literature basically just goes through what the CalmBirth course is about. So it just, you know, talks about, you know, what the CalmBirth philosophy is: with knowledge comes confidence. So it briefly touches on that and talks about the mind-body component and how we link. So if you actually flick to the other side of that pamphlet to show the viewers online, so that one there, it goes through what couples will learn during CalmBirth, and it's got the CalmBirth program, which basically goes through the fact that the 4 domains that we talk about, or that we teach in the program, looks at the psychology of birth, as you can see there, the physiology of birth, toolboxes for birth, and then the connection of everything. So the connection to birth, the baby, and each other. So it's going through the link of how that connection happens with the woman and her partner and the baby, and you know, linking it to the mind and the body and everything. So
tell me, Angela, do you think when you look at say the sort of routine prenatal classes that are, you know, also cover the topics of pregnancy, breastfeeding, you know, changing a nappy, you know, things like that. So, and quite often their labour and birth discussions may only be sort of one class of half a dozen classes type of thing, which I do feel is like just so not adequate. But this is really enhancing that. So you wouldn't be, I guess, suggesting people are doing CalmBirth in place of general prenatal, or you'd sort of think that they're better doing obviously both together, and how would that also relate to hypnobirthing, which is another thing that people can, you know, invest their funds into?
Yeah, so there's a couple of questions within that question, I guess.
Yeah.
So, and I can only speak from an Australian point of view, so I'm not sure, you know, because I imagine that it's a little bit different throughout the world, but most of the hospital-based antenatal classes within Australia, and more specifically in Perth, because that's where the majority of my experience has been, is that, you know, it focuses on, I guess, a lot of the practical things, what women are going to experience. So if, you know, the options for pain relief and that kind of thing when they go into labour, you know, it touches on breastfeeding and those kinds of things. But I guess what's missing between that and CalmBirth is that CalmBirth has a big emotional component. And I've had couples that only do CalmBirth. I've had couples that do the hospital class, the breastfeeding class, the CalmBirth class, and, you know, they want to be completely prepared for everything, and they do everything that's going. You know, you've got your couples that are seeing private obstetricians that, you know, have a friend that's been to CalmBirth and it was highly recommended to them, you know, so they come along and do the course. And then you've got the opposite side of the things where you've got women who are having a home birth. They've heard about CalmBirth and they'd really like the tools, you know, to be able to give them that best experience from that point of view. I'm lucky, speaking personally for the way that I do it, because I often do small groups, especially in the last 6 months, because we've had COVID and we've only just in some places gone back to face-to-face. I find that I can sometimes tailor the course to what's going on for that couple. So if I have a couple, a private couple coming to me, and, you know, say for example, they're having their 3rd baby, they've had a previous traumatic birth for whatever reason. When I'm going through the CalmBirth course, I can actually tailor certain, so, you know, breathing exercises or whatever it is that I'm going through in the course with them, and say, now, this is what, when you get to this point in your labour, if, you know, linking it to whatever's happened in their situation, I can say, okay, so this is what you need to do, and this is how you can work through it if this happens again. And I find that really rewarding, because when you make it personal for them, they really feel like they're getting a lot out of it. Now with hypnobirthing,
yeah, I guess I think there's probably just a general a lack of understanding of what the difference is. So if somebody, you know, if you've got a couple who have limited funds and they're basically sort of trying to choose between CalmBirth or hypnobirthing, which are both amazingly wonderful, but yeah, how will you describe the difference of what they're going to be learning?
So I personally haven't done a hypnobirthing course, but the main difference that I can tell you about is that with CalmBirth being an evidence-based accredited program, all the CalmBirth practitioners are allied health professionals that work in birth. So the majority of us are midwives. We've got doctors as well. All of the allied health professionals that work within that framework, you know, have a allied health professional basis.
Oh, okay. So are you saying that basically CalmBirth facilitators are nearly always, or they need to be, you know, medical professionals as well?
You need to be working professionally in birth to be accredited to be a CalmBirth practitioner.
Okay,
So,
I think that's really, really relevant, because
yeah, and
I've had a lot of clients over the years who have used hypnobirthing, and which I sort of tend to myself call meditative labour. And I've witnessed some, yeah, it's an amazing, amazing tool, but really it's more just that it is really just staying calm in the inside. But I certainly have had some really questionable advice that some of that clients have received from some sort of extremist hypnobirthers, where that I'm like, well, that's not healthy or safe, and I don't think that there would be some type. It's just wonderful to hear that this is all done by basically birth practitioners, pretty much.
Yeah, and it's quite extensive. The course is nearly 6 months. I'm not sure what you have in New Zealand, but in Australia we have APRA, which is the government body that governs all health professionals. So CalmBirth is a little bit the same in that you have to register every year. You have to be doing so many classes per year. And I guess from a personal point of view too, being a midwife and doing classes, I find that you get some really curly questions sometimes. And if you're not working in the birth profession, I sometimes, you know, it could be, I imagine, would be quite difficult for, you know, people to answer some, you know, some of the clients' questions. So
yes, I would agree. Yeah, having that background of that coal face of literally catching hundreds of babies, and you just do understand the complications behind it medically, just that little bit better.
Yeah.
Hey, do you want to just explain this other document that I've put up?
So that's more just for health professionals to go through themselves. It basically talks about the research behind CalmBirth and how the studies that were done with CalmBirth and how it can impact labour and birth for couples. So it just gives some statistics there. It's more, I mean, information tool for birth professionals that are interested in looking at it to perhaps promote to their clients. It's also for any, I guess, pregnant couples out there that like to have statistics on paper. It gives you some statistics there about what you can see for women who have gone through the CalmBirth program. So you can see there that, you've got a reduction in the use of drugs. Obviously, you're getting more women that are coming into established labour going into their birthplace, as opposed to women going in very early labour. And all those nice numbers that we like to see of reduction in caesareans and things like that. So it's just an article really for birth professionals to take away for themselves, to give them a bit more knowledge behind the scenes, I guess.
Yeah. So so yes, we will be able to send out those documents. I think those statistics, I always find statistics quite interesting myself. I always think that's sort of like the bottom line at the end of the day, of, the proven results. And let me just have a little look here.
So, and that's the other thing too, I just remembered, within Australia, mostly on the eastern side, but there's actually quite a few hospitals within Australia that have taken up the CalmBirth program as their antenatal program.
Yes, and I've seen that happening in New Zealand as well, and and I guess that would be in America as well.
Look, I've only just recently heard of CalmBirth in America, but it is, so as you were aware, I touched base with one of the ladies in, I can't remember where it was now, in the US somewhere, who was also a CalmBirth practitioner, and we touched base briefly to discuss the two, and they had the same name, but the from my understanding, the one in America was based on Tibetan breathing principles.
Yes.
Whereas, the one in Australia is a little bit different. So I can only speak for the accredited Australian CalmBirth course, but I know that there's probably other ones out there that may have similar names.
Okay, because and we were want to touch on that as well. The fact that simple breathing, we all know as birth practitioners, those that are watching her birth practitioners, that breathing is just one of those most simplest things that can make such a big difference. Yeah, and it's giving them those tools. I noticed that, we've got a comment here from Michelle, saying in New Zealand, the childbirth educators can and are currently training for CalmBirth Australia. And she's made the comment that the Auckland District Health Board has now taken the Aussie CalmBirth course for their community education. Yes, and I did see that's happening.
That's great, yeah.
Which is fantastic.
I believe the founder went over to New Zealand, so that's probably where that's come from. And we've got about 100 educators, the majority being in Australia. We've got one in France, and I think we've got another person in Malaysia. Don't quote me, I'm not 100% sure on that. But so we do have, I think it just takes time, I think, to needing that qualification to be working in birth. I think sometimes takes a while for it to filter out, because of the time involved to do it and stuff like that. But it is nice to see that it's growing.
Yes, absolutely. And look, we're going to be winding up soon. Is there any other questions that anybody has? Please feel free to type them into the Q&As. I always think that it's really fascinating as a midwife to speak with those birth professionals who are or have been involved in high risk and complex care for women, and how it's still possible to keep that normal. And I know at our last conference that we had, Emma Parry, who's a very respected obstetrician in New Zealand, and she talked about that subject specifically, and she was actually head of the most complex area of care, where she like every single client she was dealing with was incredibly complicated medically, and in her insistence on how it is still possible to keep that holistic style to it as well. So do you want to sort of give us a little bit of your thoughts on that, seeing as you've worked in that area as well?
Look, I think if you have a couple that have either been to something like CalmBirth where they've had some of those tools and knowledge instilled in them, or you've got a couple who is already very educated and knows exactly what they want, because you've all seen it. You've seen those couples that come in, they know exactly what they want, and it's, you know, things are going to just go that way. And, you know, I would say it's definitely possible. You know, I've seen women come up from the birth centre who are planning a nice normal delivery, and for whatever reason come whizzing up to birth, you know, birth suite because, you know, they've either got meconium or they need an epidural or something's gone untoward for whatever reason. And I think the big key is communication. I'm always saying to the ladies, communicate with your caregiver. And most of us, like, you know, you're always going to come across someone, there's always a dragon somewhere or, you know, a monster somewhere. But most care providers, you know, if people can stand up and say, look, I would really like this, or I'd really like to avoid this. You know, so communication's a massive key, and that goes both ways. You know, I think the care for birth professionals, trying to put yourself in the client's shoes, and obviously we want to keep mum and baby safe. That's our ultimate thing at the end of the day. So as long as, you know, the couple are aware that what we're doing in that scope of high risk is going to keep mum and babe safe, you know, as long as we can keep communication between the two, it's really important. And for the couples out there, it's knowing that we use the acronym BRAIN in CalmBirth, and, you know, it's talking about, I guess, if things go untoward, some of the things that a couple can take on board, that they can say to their caregiver if things crop up that they're a bit worried about or they're not sure. You know, so you're looking at, you know, if you have someone that comes in and says, look, you've stalled at 6 centimetres, you've been labouring for hours, I think we should go for a caesarean. And you know, so you can say, well, look, how's baby doing? How's mum doing? Is everything okay? If I don't choose to go down this road, how long have I got? Or is there any other options that that we can try first? You know, I'd really like to just have a little bit longer. If baby's okay, mum's okay, is it okay if we try, you know, something else first? And if that's possible, how long have I got? So, you know, is that the caregiver happy to give that woman half an hour or 1 or 2 hours before they reassess the situation again? So they're the sorts of things that I suggest to couples that are going into high risk scenarios. I did have a lady who had had 2 previous traumatic caesarean sections that were in a high risk setting, who came to me, you know, for the CalmBirth course, hoping for a VBAC. And, you know, so while you are instilling all those beautiful things that you learn in CalmBirth to empower yourself as a couple to go through that journey, you're also instilling the fact that we want to keep mum and baby safe. And at the end of the day, you know, if you end up back in that high risk scenario, you've got tools there to, you know, go with your breathing and other tools that you can use to help get through that journey in a positive way, even though the actual experience, you know, may have become a little bit more high risk.
Fantastic.
Yeah.
One last question. If any of the uh, our guests watching this are keen to find out themselves about becoming qualified in CalmBirth,
Yeah.
what's the best way for them to do that?
So they can either contact me, and I will give them the contact details, or I can put it in an email for you. But our contact person is Karen McClay, who's the director of CalmBirth. So they can either contact me, and I can put them in touch with Karen to find out more, or if they just want to find out information about the course, I'm happy to do that as well. So just feel
Wonderful.
free to get in touch with me via email. It's no problem.
Okay. Oh, look, that's just fabulous. Well, thank you so very much for your time,
Thank you for having
Angela,
me.
today. Is there anything that we missed that you would like to add on?
No, I mean, I think we, touched on things in scattered ways, which is sometimes the best way, because
Yeah,
then it
organic conversation.
yeah, you talk about things that you haven't planned on talking about, and vice versa. And, I just probably briefly, I guess, bringing in a bit of breathing, because it's an important part of the CalmBirth course, but it's an important for the birth practitioners out there, and for anyone listening. Breath is really, well, breath is life, isn't it? And it's an amazing tool, and it's a very simple tool that we can use when we get anxious. So I use it on my kids. I use it, on my friends, but specifically within the pregnancy and birth realm, it's really important, because you can actually help a woman and a couple to really become focused and centered very quickly when they tend to feel like they're becoming a bit unhinged. And it's a very easy tool to learn with with practice. And I wrote a quote that I absolutely love, that I'd just love to share with you before I go. But
Oh, please do.
let me just see if I can find it now, because I haven't really looked at any of my notes. Oh, here it is. So it's actually by a Tai Chi master called William Chen. And I love this because he likens a healthy breath to the ebb and flow of water meeting a beach. So if you imagine the waves lapping against the beach with that in-breath, and then the water trickling back out to sea with the out-breath. And I really love that, because it's very visual.
Yes.
But it's calming as well.
Yes.
And I like that for me. But I just quickly bringing up another thought that I had too is with CalmBirth is that, and for birth professionals and couples out there, is when you're going to a class and people say, oh, look, this is what you need to do. Always find a activity that you can resonate personally back to yourself. So whether that's, visualization or meditation, I could say one thing, but that may not resonate, with the couples. So I always encourage couples to find something that's personal to them. And it's a really good tool of helping people to remember, but it helps them to get into that calm space by focusing on something that they can relate to, as opposed to something that someone may have said, okay, you need to do this.
Right.
It's a different way of putting.
So a couple of examples of what you might mean that they might use, that they resonate with?
So for example, it doesn't have to be with breathing, but just, even in, say for example, a couple is in labour. One of the videos that we show talks about a couple who use the City to Surf Marathon in Sydney as their focus for their labour. So the husband, and wife had both done this marathon. And when she was getting to the stage where she'd been pushing for quite some time, and the husband said, we're almost there, we're at Heartbreak Hill, which apparently is a certain spot in the City to Surf in Sydney, and this lady really resonated with this because it was personal to them, and it just gave her the power to go, "Well, I'm on the home run now," you know.
And really neat that it was a memory that relates to both of them as the couple.
Yeah, that's right.
Yeah, that's cool. I
So
like those
yeah,
comparisons.
it's just a nice way of it just becomes easier then, because often when you're teaching something, people are worried that they're not going to remember. But
Yes,
if you allow them, if you say, look, don't worry that you're not going to remember everything, because your subconscious mind is going to remember things that your conscious mind's not going to remember. And if you give them, or it could be a holiday, lying by the pool in Bali or something,
yeah.
something like that. It doesn't matter. But if you give them those options, they go, oh yeah, well that makes it so much easier.
Going back to their happy place.
That's exactly right.
Finding their bliss.
Yeah.
It's just so wonderful. Thank you so very much, Angela, for your time. And I know that when I say thank you for your time, it was particularly relevant because it's a very early time.
Yes, it's still dark here.
And so look, thank you so much. And thanks to those of you who are here watching live, and those that'll be watching it later on video. And there's no point putting on these webinars when we don't have an audience. So you guys in the audience are really important to us, and we're working hard here at IMPO to provide some really relevant, useful information for everybody. And appreciate your time, Angela.
No, I appreciate it.
Yeah,
Thank you.
appreciate everyone's participation. So we'll wind it up there, and so everybody have a lovely rest of your day and rest of your week. Bye, everybody.
Bye.
Thank you.